Well, hello folks, and here we are 2 weeks after surgery, and we've got a new nice dressing on. Now earlier today I went and had my clips taken out, and I've got a little video to that now, so I'll show you that.
Right.
Oh, well, there's no pain at all there.
We're going to go every other one because that's protocol, okay? Yeah. Just to make sure it's not coming open, because we might get a bit further down and think, well, actually, they could do with a few more days.
Right.
Okay, so we're going to go every other one first. The great little tools. They might be a bit deeper going down, okay?
I can't impress it's short as it is. Or it's a bit of a wonky line.
Just a bit. Just a bit wonky. But you know, once all this dry blood's off, it's going to heal lovely.
Oh, right. Well,
I can tell already, like the scar, it's going to be flush. Right, it's going to get tender now, okay? Lovely. Happy to have the rest out?
Yeah,
it's all healed, okay? This one's hanging out anyway. There you go. That's probably going to be your most painfulest one. Nearly done. Did they give you any dressings? Right, last one, okay. It's perfectly normal. When you get home, just stick a dressing on it just for a couple of days.
Okay.
We've not got any dressings long enough. So put one of yours on what they gave you from the hospital, just for a couple of days. And then you can take it off.
So it's not going to... So when I try and get in the taxi now, and I'm bending my leg in some way, it ain't going to split open up. Right,
no, you might get a little blood come out where I've just took those staples out.
Right, okay.
Which is completely normal. But yeah, look at that.
So I've been told to put Vaseline on it, so I've just covered it all in Vaseline. And now this is another sterile dressing. Well, a bit of a bodge job, but I had to put the dressing on myself because I forgot to take it to the doctors. It's not on brilliantly, because I realised my scar is not in a straight line. So trying to get the dressing to cover it all. So what did you think to it? Well, I went to the GP. Getting to the GP was a bit of a problem. But the problem was getting the shoe on and sock on. I can't bend my leg that much to do it. This morning it took me 35 minutes to put a sock on, a shoe on, 5 painkillers, and a lot of pain. I managed to get it done in the end. What I could have done with better is some sort of aid, which I've ordered. Hopefully should be coming tomorrow. I've had my clips out. I didn't have any stitches, it was just clips. About 30 of them in total. Now the unfortunate thing is when I went to the GP, I thought I was going there to find out about my medication because my medication is running low. Seems that wasn't the case. They were taking my clips out. So I forgot to take the dressing and the particular tool they gave me to the GP. Fortunately, they did have the clip removers. They didn't have the wound covering to cover that amount of length. So what I've done is got home eventually via a Tesla X80, I think it was called. It's the ones where the doors open on the side like wings. And fortunately, it was a lot easier to get in and out of that one than it was to get in the one I went in. I went in a saloon. The Uber driver was panicking, thinking I was giving him a bad report because I was screaming trying to get into the Uber. Again, because I can't bend my leg. But the Uber I got back on, I got a comfort one, or extra large I think it was, which I managed to get in and out without too much problems at all. Once we got to the doctors, I went straight through, took my clips out, had a little bit of a chat about progress and how other people have been dealing at this point in time. And it seems that I'm probably about where a lot of people are at this time. I'm hoping to be further than I actually am. Some people are a little bit further, some people aren't. But so I got physio on Friday in the hospital, so I'm hoping that is the time where we start to get to manoeuvre my leg a little bit better. So in the meantime, this week, been doing the exercises as they said. Some days I've done really well with it, and one day I even managed to get to 70 degrees. Fortunately, I bought an aid for it, which is not here, to measure it out, to work out what degree ratios I'm doing. So that's helped a little bit. It does push you to try and get that little bit further every time. Unfortunately, yesterday I had a really bad day. Most of the pain I've been getting has been around here and down here, not actually in the joint itself. I've been told by the nurse I've got a lot of bruising behind my leg. I can't see that from my angle. It's here where the muscle, that's still very tender, very weak, and I'm hoping it's going to start to strengthen up soon. Yesterday, the pain was actually in the joint, and I think it's the scar tissue that's around the actual joint. It was that bad that I couldn't bend my leg at all. I think it stayed at like 12 degrees all day. And it was quite painful as well. I was constantly putting ice on it, or icy water. Today, a little bit better. I managed to do some slight bending this morning, managed to get up to about 60 degrees. It is a bit frustrating. As I said before, the consultant did say after I had the surgery, you're only going to get 80 to 90% movement in it for the rest of your life. And I'm thinking, well, if you did told me that before the surgery, I might not have had it. Also, the amount of pain I'm in, I did know there was a lot of pain coming, but I thought pain would come, but I'm still managing to bend my leg. At the moment, it's here, but nothing's happening. It's still hurting. So I'm hoping this week, going into the third week, is going to improve it a lot better. I think I've gone past the infection stage, hopefully. There's no swelling, no red marks, no hardness. So that's better. I've been taking blood thinners. That is ran out today. So I'm hoping 2 weeks of blood thinners was enough. And I wasn't meant to be taking more because I have no more. Spoke to the doctors and hopefully they're going to get the pharmacy to sort me out with extra drugs. Fortunately, while I've been over the last week, the Army Welfare Officer came, who obviously finds out if any serving soldiers or veterans. He's been in contact, put me through to a few places, which I think will be great for my mental health while I'm at home. Fortunately, this week I've had my sister's visited twice. The family dog's been around here, so that's quite pleasing. I've heard a message from my son, and I've also had a colleague from work that's been. So I haven't been 100% isolated, but it does feel on a daily basis that push to keep going. I am trying to get up at a regular time in the morning and a regular time in the evening I'm going to bed. And then apart from that, in the daytime, I take my painkillers as I was told by the hospital. As soon as you take your painkillers, and then you have your ice or the ice pack ready to go, then you do the exercises. Once you put your leg back up, that's the point when you put the ice pack on and let the swelling calm down. It is progressing. I am not as happy as I would like to be. I would like to be able to bend my leg more by itself more often, but that's not happening at the moment. I'm willing to put the physio in, but it's just not wanting to do it at the moment. I can't bend my leg much at all at the moment. At home, a lot of people are saying, you'll get fat in couch potato. Well, I don't think I'm any fatter than I was before. In fact, actually, if anything, I think I'm losing weight. I'm trying to keep my food regime to quite low. I have a fibre breakfast with fresh fruit and a coffee. And then I don't generally eat all the way through the day until the evening time, where I have my evening meal, which generally is a ready meal. So ready meal portions are quite small anyway. And that's basically about it, all I'm having apart from fluids as well. So with that, I don't think I'm gaining too much weight. We are progressing in a way. It's been 2 weeks today since the surgery. I think things are on their way up. I'm hoping they're going to improve. I've had to put the dressing on myself. So when I got home, the nurse told me I was to put some Vaseline on the wound to keep it moist. She says it's knitting together well. She says it actually looks like it'll be a nice scar when I finish, which is better than obviously the students from our school believe that Mr. Stanley's leg has been amputated. That's the rumour that's going around. I can assure you it's still here. Although, if I don't start getting any more movement out of it, I might chop it off myself. So, shorter video than last week's. Hopefully you still get something from this. In the next week, because we've got Friday, we've got first physio appointment. Then on Monday, I've got another appointment with the doctor themselves. They're going to look at the wound. And then the following day, I think I've actually got another appointment at the hospital. So a few more things happening over next week. So until then, I shall see you soon. Look after yourselves and bye-bye hikers.